Hi everybody, this is Bridget Surratt with Canna Patient Resource Connection, and welcome to another riveting class about cannabis and how patients can use cannabis in their therapies. Today's class is cannabinoids and terpenes and what they can do for you. Let's start off with what are cannabinoids. Cannabinoids are basically chemicals that interact with your endocannabinoid receptor system. You have endocannabinoids, and in case you aren't sure what those are cannabinoids that your body actually makes to interact with that specific system. And we have ones like anandamide and 2-arginonylglycerol that float around our body and help us maintain homeostasis and help our bodies heal. Phytocannabinoids are found in plants, basically, including cannabis, so we will be referring to phytocannabinoids quite a bit. And synthetic cannabinoids are lab-made biosimilars, and they actually are already FDA treated to treat a lot of different things like glaucoma, nausea, and pain. But the most interesting is Insys Labs was awarded orphan drug status in 2014 for their CBD analog that is used to treat glioblastoma multiforme. Not just treat the symptoms of it, but to actually treat the glioma as it is. So does cannabis, is that the only plant that contains cannabinoids? Nope, not at all. Ever wonder what the obsession with chocolate is? Chocolate has cannabis or cannabinoids. Echinacea in the roots also has cannabinoids, and so does helichrysum. So let's go over some of the main cannabinoids, and these are by far not a comprehensive list of cannabinoids. There are many more out there, including one of my favorites that I didn't go over here, CBN, which is highly useful in the treatment of insomnia. So let's start off with tetrahydrocannabinolic acid, and that's a mouthful, so we'll just call it THCA. THCA becomes THC when heated or degraded over time. THCA is incredibly anti-inflammatory and does have neuroprotective properties. It's useful in most chronic illnesses. And the exciting thing is THCA is really being studied for autoimmune disease. And that's really exciting to me because I have autoimmune disease. THCA is also anti-nausea and pain relieving, and I found several studies where it, in prostate cancer, had anti-proliferation properties, which means it slowed the metastatic process in prostate cancer. That's pretty amazing. It's also non-psychoactive, so if psychoactivity of THCA is an issue for you, THC, the psychoactive activity of THC is an issue for you, THCA might be a better alternative. Tetrahydrocannabinol is THC, and that's the most known cannabinoid that there is. It's broken down from THCA, and it does bind to both receptors. I think one of the misunderstandings is people don't think that THC actually interacts with the CB2 receptor in the immune system, and it most certainly does. It's used for nausea, pain, seizures, autoimmune disease management, and more. It is the most known and studied cannabinoid, and THC is actually an opiate receptor agonist, which means that you can use THC to increase the strength of your opiates, therefore needing less. So THC has some pretty interesting properties and is highly medicinal in its own right, even with the psychoactivity. Next, we're going to discuss cannabichromene. Cannabichromene is one of the little-known cannabinoids, and it's just now starting to pique the interest of researchers. According to Mara Gordon, she has found that in order to get the most CBC out of her plants, when she is harvesting for CBC specifically, you have to do it in the first, after say like the first 2 weeks of flowering. After that, the CBC tends to degrade and is no longer there, and finished cannabis will have minute amounts in it, but to get the most CBC, if that's what you're looking for, about 2 weeks into flowering, you can start harvesting for cannabichromene. Right now, there's nothing conclusive, but it is being investigated for use in autoimmune, autoinflammatory, and anti-inflammatory diseases, or inflammatory diseases. Patents are pending, and this is pretty exciting stuff, for the antiviral, antimicrobial, and antifungal properties, which could make this an incredibly important immune system disease-fighting cannabinoid. Right now, though, it is difficult to find studies, and there are few studies to be found. Next, we're going to go over tetrahydrocannabivarin. And the ones with varin on the end really have some interesting properties. And I'm excited to see all the research coming out with them. But THCV specifically does exhibit the biphagic properties of having different effects at different doses. So low doses tend to block the CB1 receptor, and higher doses, it tends to bind to the CB1 receptor. Low doses block appetite and increase energy expenditure. And it is patented at this time to protect the pancreatic islet cells to promote insulin homeostasis, which means THCV could be incredibly useful in the treatment of diabetes, both type 1 and type 2. And it could help the pancreas maintain insulin homeostasis. Cannabinoids. Cannabigerol, CBG. CBG is also one of those that is extracted early. You don't wait for full harvest, but you wait and extract it about 6 to 8 weeks into flowering to get the peak amounts of CBG out of your harvest. Potential uses, it's used in glaucoma to relieve eye pressure. It's showing to be a neuroprotectant. Exciting stuff regarding inflammatory bowel diseases, colorectal cancers, cachexia, and bladder issues are all coming out. Also right now being looked at psoriatic arthritis and psoriasis treatment as antidepressant and pain relief. So keep in mind CBG may be useful if you are trying to treat any of those. Next we have cannabidivarin, which is CBDV. It's used as an anti-nausea and anticonvulsant. Most of the research that I found on CBDV regarded epilepsy though. And several patents are owned by GW Pharmaceuticals, but they do own one on CBDV for the use of CBDV in the treatment of epilepsy, and that's the patent number right down there. Now let's go on to terpenes. Terpenes, and like I said, same with the cannabinoids, this is not a comprehensive list. There are over 200 terpenes, but I'm going to go over some of the more popular ones that we find in cannabis. Terpenes are a class of odoriferous hydrocarbons made by plants and animals. Basically, it's what we smell. So if you're touching pine sap or you're, peeling lemons, that sort of thing, what you smell are the terpenes being released as you do those things. They're used in aromatherapy. They're used internally therapeutically and topically. They're even used to alert us to natural gas leaks. That stench that natural gas has actually is a terpene, and of course in air fresheners. We know cannabis has terpenes, but what we don't know and what tends to often get overlooked is that terpenes play a major, major, major role in how a particular strain works. Not every terpene in this is covered, but terpenes and the terpene profile of each of the strains really are what make each strain a different medicine. If you just want THC, you can go take Marinol, but Marinol tends to feel pretty crappy, and according to Mara Gordon and her lecture, it really is the terpenes that determines the effect. That's really what we're going after, not just the THC when we use cannabis recreationally. Let's go over some of the more popular terpenes that you find in cannabis. My favorite, or one of them, I have two favorites. The first one is beta-caryophyllene. It's found in black pepper and cloves. I tend to use clove oil in my muscle rub, and there's a reason for that. Technically speaking, beta-caryophyllene could be considered a cannabinoid because it is the selective agonist of the CB2 receptor and the only terpene that actually directly interacts with the endocannabinoid system. So you could actually have a Schedule I substance in your kitchen pantry there. But hey, just go in, sniff it, you're activating your CB2 receptors. Woo! All right, so beta-caryophyllene is incredibly anti-inflammatory. It's highly anti-inflammatory. It's very useful in the treatment of inflammation or inflammatory diseases. It does inhibit platelets, It's analgesic, which means it works on pain, and it's antipyretic, which means it reduces fever and can possibly substitute for acetaminophen. Linalool, which is the next terpene we'll discuss, is most often associated with lavender. It's very anti-inflammatory as well. It's calming and anti-anxiety, which is why people use it in all of their sleep lotions, all of their calming rubs. You walk into a massage parlor and it smells like lavender. And so it's supposed to be very anti-anxiety and calming. Lavender also is antibacterial, but topically it can be an irritant, so you do have to be careful. I do also use lavender in my muscle rub, and I use it as a counterstimulant or counter-irritant because it irritates the nerves and it provides counterstimulus to disrupt the nerve signals from my original pain. Myrcene is my other favorite terpene because it is also highly anti-inflammatory. It's used in autoimmune disorders and ALS. It's used to fight hard-to-treat pain. So if you have incredibly hard-to-treat pain, you want to definitely get some myrcene in there. And if your strains, you don't know if they have myrcene, it's also found in mangoes, hops, and thyme. You know the old adage of eating a mango will get you higher, the old trick that everyone uses. It's not that you get higher, but mangoes are high in myrcene, and what they do is they cut through the blood-brain barrier, allowing increased uptake of your cannabinoids. So basically, you're absorbing more cannabinoids when you use myrcene or you utilize myrcene. So you're getting more bang for your buck as far as that goes. Myrcene is also highly sedative and fantastic for insomnia. Some strains high in myrcene are Gorilla Glue and Sweet Tooth, and those two have been phenomenal as far as treating my autoimmune diseases, I have to say. Pinene. Pinene, just like the name, it's found in pine trees. It's that lovely pine smell that you get whenever you climb a pine tree or you walk into a house that has evergreen wreath or something like that, and you go, ah, that smells so good. It's so uplifting. So pinene is actually used as an energy-enhancing aromatic in aromatherapy. Ayurvedic medicine asserts that pinene is used for antibacterial, antimicrobial, parasite control, which is quite interesting, as pinene is thought to have been developed as insect control for pine trees and as an anti-inflammatory. Lastly, one of the more popular terpenes is limonene, and you will hear a lot of people talk about limonene. It's what's found in lemon rinds, among other things. And as we know, lemon is used to be a mood enhancer. Reflux, heartburn, let's see, it's used to treat reflux and heartburn. It dissolves cholesterol-containing gallstones, which I wish I had known when I had gallstones. Neutralizes stomach acid, so it's incredibly useful in GI upset and for gallbladder health. It's also used to help prevent kidney stones as well. I know my husband uses it to help prevent his kidney stones, and thankfully it's actually worked. So he eats a lemon a day or a lime a day. It's also used as a co-therapy in some cancers because it does show anti-tumoral properties, and like I said, as a mood enhancer. So here we are. Here are some of the sources that I used to get this, and I would highly recommend this particular lecture from Mara Gordon. It's on YouTube. It's free. It's about 45 minutes long plus question and answers, so it makes about an hour and 5. But it's a really useful lecture and would generally help increase your knowledge of how to clinically apply cannabinoids if you are treating illness. Here are other sources and even more sources. I want to thank you very much for taking our class, and we hope you found it very useful.